Good day, everyone. My name is Oladapo Olawale Afolabi from the Lab of Vascular Biology, Federal University of Minas Gerais. The title of my presentation is The Impacts of Severe Calorie Restriction on Cardiac and Vascular Remodeling. Calorie restriction involves a reduction in the daily average calorie intake to between 10 and 40%, and in very severe cases for up to 50%. And this is done without causing malnutrition and without affecting the intake of essential nutrients like vitamins and minerals. On one hand, while high-calorie diet raises cardiovascular disease risk factors such as hyperglycemia, dyslipidemia, diabetes, stroke. Calorie restriction, on the other hand, causes certain metabolic adaptations such as reduced lipid profile, reduced inflammatory status, improved glucose metabolism, improved endocrine profile, and reduced systemic oxidative status. This leads to certain physiological adaptations with effects on the cardiovascular system, such as improved endothelial function, lowered blood pressure, improved heart rate variability, lowered intima media thickness, and improved left ventricular diastolic function, which cumulatively has profound clinical outcomes such as reduction in the risk of coronary heart disease, reduction in the risk of stroke, reduction in cardiac arrhythmia, reduction in peripheral artery disease, and reduction in heart disease. Calorie restriction, the mechanism of action of calorie restriction is proposed to act in two ways. One, by its effects on silent information regulatory transcription factor, SIRT, and the other by having effect on protein creatinine, and all this cumulatively leads to the activation of endothelial nitric oxide synthase, which causes an increase in nitric oxide production, which now causes endothelium-dependent vasodilation, reduced blood pressure, and the improved post-ischemic cardiac recovery. With this at the back of our minds, we therefore hypothesize that severe caloric restriction in rats since birth will have cardioprotective effects in terms of its impact on cardiac and vascular remodeling following ischemia-provoking pharmacological and surgical insults on the heart and aorta. And our objectives include to evaluate the mechanisms involved in vascular adaptation under caloric restriction, to evaluate the possible vasculoprotective effects of caloric restriction in a model of expansive arterial remodeling and new intima formation in carotid arteries, and finally to evaluate the possible protective effects of caloric restriction in cardiac hypertrophy induced by the administration of isoproterenol. The materials and methods involved using the animal model that has been placed on 50% calorie restriction, and that involves a mother after delivery is placed on 50% diet reduction, and that is done by pair feeding. When the pups are weaned, the pups themselves are placed on 50% calorie restriction for up to 30 days, after which the animals are sacrificed and samples are collected. Now, the treatments during those times involved the pharmacologic treatment and surgical treatment. The pharmacologic treatment involves the administration of isoproterenol subcutaneously for 10 days at the dose of 3 to 10 milligrams per kg per day, and that causes cardiac hypertrophy. And that is done 10 days before sacrifice, after which the animals is euthanized and samples are collected. The surgical model involves inducing carotid artery remodeling, involves the occlusion of the right common carotid artery for up to 14 days. The effect of calorie restriction on the vascular system is assessed by evaluating the arterial samples on their concentration response curves to contractile agonists such as phenylephrine and their response to relaxant agonist such as acetylcholine, while ex vivo cardiac function is evaluated using a Langadorf apparatus, and that is assessing the ventricle function and coronary flow under basal conditions and under adrenergic stimulation. The methods for analyzing our samples include real-time PCR, immunohistochemistry, immunofluorescence, morphological analysis, histological analysis, Western blot analysis for the proteins present, and vascular reactivity. Similarly, in the induction of new intima formation in vivo by carotid occlusion, we found out that comparing sham animals with animals that were placed on calorie restriction, we found out that calorie restricted animals compared with animals that are fed ad libitum, we found out that calorie restriction causes a significant reduction in neo-intima formation, as you can see from this graph and as you can see in these pictures right and left. Similarly, while we have not used isoproterenol, we observed that comparing calorie restricted animal with sham, calorie restriction causes a significant reduction in hypertrophy markers, as we can see here and here and here, and also causes a significant increase in cardioprotective markers. While similarly, preliminary results also show that calorie restriction causes a significant increase in anti-inflammatory biomarkers such as interleukin-10 and causes a reduction in pro-inflammatory markers such as interleukin-6 and TNF-alpha. So the question we ask ourselves is, we observe that calorie restriction causes a reduction in systemic inflammatory status. So the question is, could this data be related to a possible prevention of cardiovascular damage that is related to inflammation, such as endothelial dysfunction and cardiac hypertrophy and new intima formation? In conclusion, preliminary results show that calorie restriction, that is 50% of food intake, causes a reduction in vascular contraction and improved vasodilation. It also causes a reduction in cardiac hypertrophy markers and improved cardioprotective markers. It causes a reduction in systemic inflammatory cytokines and improved anti-inflammatory cytokines, while also reducing vasoconstriction and enhancing vasodilation. In conclusion, we establish that severe calorie restriction promises profound beneficial impact on cardiovascular system and could prevent or retard cardiac remodeling, and this has profound implications for hypertension management and cardiovascular damage. Thank you very much. I'd like to acknowledge my research group in the lab of vascular biology and the support given to me so far by CAPIS. Thank you very much.